Hi there, this is Hanna Lim from Lollaland, and the reason we're joining you here today with Kary Rappaport is we've had a lot of questions recently on just, I guess, feeding, drinking related questions and why straw cups versus sippy cups. And so we thought we would bring an occupational therapist who specializes in feeding to sort of answer our questions and flesh out this whole debate. So, hi Kary, thank you for joining us. Can
Hi.
you please tell us a little bit about yourself? So background, what do you do now, and maybe how people can find you if they need to.
Sure. I am a pediatric occupational therapist. I specialize in feeding, eating, and swallowing. I work out of Children's Hospital Los Angeles, but I also have a small private practice in the greater Los Angeles area. About 4 years ago, I started also consulting with families of typically developing children just who have small difficulties, like who are not transitioning well into solids or who have difficulty with cup drinking or just little problems like that, in addition to big feeding issues like you would see at Children's Hospital or like some kids have in the community. So if they needed to find me, I have a website. I'm available through that website at KaryRappaport.com, which is Kary for Kary, and then Rappaport.com. But other than that, I'm also at Children's Hospital a couple days a week.
Great. Okay, so I'm not sure how familiar you are with this question, but sort of what is the recommended age for sort of weaning off a bottle? Because I think that's one thing. I mean, I have friends whose 4-year-olds are drinking from bottles, and then I have some whose 9-month-olds are, drinking out of sippy cups. So what's the range, the ideal range?
It definitely is a range. With anything like that, it's never like you have to be off of it by 18 months.
Okay.
But it is recommended that you start the process as early as 6 months. That is when a baby is most amenable to starting to wean off of a bottle. Most kids, like for example, people I think are a little bit more aggressive with getting off of a bottle versus breastfeeding. So a lot of kids breastfeed through 1, even 2, 3 years of age, whereas a bottle, people tend to want to wean off of that closer to a year if you can, and most people will recommend being off of a bottle entirely by 2. But again, if you start early, it's not that hard to get off of a bottle by around a year of age, and the longer you hold on to it, the more attached to it a child becomes. Just because they're familiar with it, it becomes almost like a lovey and a comfort in addition to just a way to drink. So before the age of 2. And then there's also, just in terms of how the palate develops, after the age of 2, the palate becomes a little bit more firm or set in its ways. So if you're drinking from a bottle consistently after the age of 2, there's some thought that your palate would be more impacted by it. So weaning off before 2 is a good idea, I think.
Interesting. Okay. Well, so the most common question I get with Lollacup is, why do you guys only make straw cups and why not sippy cups? And for me personally, it was actually motivated mostly by my pediatrician. She is this crusader for straw cups, and I'm not saying that she's right, but she did point out that there are these like speech benefits. She mentioned something about muscle tone in the mouth. I can't go into specifics, but I was like on Google and I'm looking around, and there's a lot of stuff out there that there's this whole big debate on sippy cup versus straw cup. So I kind of wanted to just hear your thoughts on that. For me personally, my daughter could not coordinate the motion to like do this, then tip back. Even though she was on a bottle, when it was a cup, she just couldn't get it. So like doing this and then sucking hard enough to get past all the spill-proof valves and stuff, it was just like the sippy cup was impossible. And yet we would go to a restaurant, give her a plastic straw and the glass of water, and she'd be fine. So that was sort of the impetus for Lollacup. But so I kind of want to hear your occupational therapist perspective on straw versus sippy.
So I tend to be more middle of the road on everything. So I definitely don't have this like intense argument that says it has to be straw or it should never be sippy or anything like that. But I do have a preference for straw, sort of like your pediatrician said. I think there are a few different things that lead into what make me as a feeding specialist encourage parents to use a straw versus a cup, versus a sippy cup. So For starters, I think it's important to think just even about where sippy cups come from. So I think it was like the 1990s when they were first created. It was now several years back, but it was just developed to keep a cup from spilling. So it wasn't developed for optimal oral motor development or mature feeding patterns. It was really intended to be used to keep your floors and your children clean. So it has sort of morphed, I think, during that time into something that parents see as a developmental milestone. Like we transition off the bottle onto the sippy cup. But that's not really its intended use. And it kind of becomes an issue, especially because like with the bottles, the longer you stay on something, the more children hold on to them. So it can become very difficult to wean off of a sippy cup, where it's not a tool you'd use into adulthood, like say a straw, where all of us as adults often use straws. So you would build a skill and then maintain that into adulthood. With the sippy cup, you're transitioning onto something that you're going to have to transition off of again and then onto something new. And then I have a pretty long answer for this one too that I give to parents. So there's kind of more layers to it, but like you mentioned with that your doctor said with the oral motor development. So with a sippy cup, you're actually using a very similar motor pattern to what a child uses when you drink from a bottle. So the jaw ends up being slightly forward, and the tongue gets sort of pinned or anchored underneath the spout of a sippy cup, especially for a hard spout sippy cup.
Okay.
And when a child drinks from a bottle, they use a similar pattern. Their tongue usually, especially at first, from birth until 6 months, it'll move forward and backwards and up and down. When you are an older infant, older child, as well as an adult, you want to use the back of your tongue a lot, but the tongue tip usually just moves up and down. It doesn't move forward and backwards, especially not when you're drinking. It does obviously if you're cleaning your lips or something, but it's not a major part of our speech and it's not a major part of our eating patterns. So with a spouted sippy cup, you're encouraging that anterior or that protruded tongue as well as that protruded jaw, and you're not really encouraging the tongue tip that you need for typical feeding, eating, and swallowing. When you're drinking from a straw, people note that little kids, very, very little ones, tend to also anchor their tongue under a straw, but pretty quickly you stop that, and because the straw is not as big and not as wide, your tongue doesn't get caught under it, so it can move back and over the straw and up against your palate to swallow. The other thing that's important that I think a lot about is the stability of the jaw. So when you have a spouted sippy cup, you tend to stabilize your teeth in your jaw on the spout. So again, a really typical thing for kids to do. So a 6-month-old who you give a spouted sippy cup to, or even an open cup to, will bite the rim of the cup. And that's because they don't have the graded jaw control to open their mouth to a certain level and just hold it there. So you or I can hold a cup up to our mouth and keep our mouth open just enough so that we don't spill liquid, but that we're able to drink for several swallows in a row. Like I said, an infant would bite that cup to stabilize because it's easier to just clench their jaw and hold it there than it is to have a nice open mouth. That's fine, but you want to see them wean off of that pretty quickly. So past the age of 9 months to a year, you start to see them have improved graded jaw control, and then really around 18 months and on, you would see a more drastic increase in their graded jaw control. So you see them biting on an open cup less, they're able to just stabilize it against their lips, and you actually see that become even more important for biting off a piece of food and chewing. So it's not to say that if you're drinking from a sippy cup, it will prevent those patterns, but you are not practicing those motor patterns. And actually, a friend of mine recently, who's a physical therapist, was talking about another colleague of hers who is doing research on typical motor pattern development in infants, and she was noting that in typical infants who crawl, they will crawl the length of 35 to 45 football fields a day if you let them, which is a huge, huge distance.
Wow.
I know, and so for me, I was relating that a little bit to the motor patterns that we use for feeding.
Right.
It's the same sort of thing. You want a child to have repetitive and consistent practice of a new motor pattern to learn that skill. So if you're asking them to just use old motor patterns that aren't going to carry them through adulthood, they're not getting that consistent repetitive practice like they would, say, with a straw cup, or eventually, if you're giving them chewables like they learn how to do with chewing. So it's probably not the end of the world for most typically developing children, but if you have a child who is even a little bit prone to developmental delay, I think it has a big impact on their overall ability to reach those milestones later in life if you're not giving them that opportunity, that very consistent, repetitive practice of that motor skill. That's my long answer.
No, I mean, I love that. Like, I learned so much in just, that few minutes.
You brought up so many great points. I had no idea that the Sippy cup was developed simply to be spill proof. And it's funny that you mentioned that because the number one question we get is, do Lollacups leak? I totally get why a parent would want a children's product to be mess free, and every other cup on the market is in fact spill proof. But I developed the Lollacup because my daughter simply could not suck hard enough to get past those valves. And I just wanted to eliminate challenges and make sure my daughter was getting her fluids.
Because I have a daughter as well, and I think about that convenience. But I think it's important if you keep track of what is developmentally appropriate, then you know if you're constantly foregoing the developmental appropriateness for cleanliness, you've got a problem. If sometimes you lean towards cleanliness because you want to have your child be clean, it's, that's appropriate.
Okay, so another question that we commonly get is, how does one teach a child to use a straw?
I don't know if there is really a technical way to teach a child, but there are some tricks that you can try. Really, a 6-month-old can suck from a straw. If they can suck from a bottle, they can suck from a straw. So if you introduce it early, a lot of times their developmental reflexes kick in and they just automatically suck and swallow. And like you said, they get an immediate response and a reward for sucking, and then they learn this is how this works, and they can keep going from there. If you've missed that window or your child just for some reason did not pick that up when you tried, you can try a few other things. So first off, I always model. So have the parent or I will drink out of a straw a few times and then give it to the child so they see what's going on. And then the best thing that I found is either to get some type of a squeezy drink, Sippy cup, or excuse me, like a juice box.
Oh, I see.
Is not what you normally want to give. Like juice is not what you want to give a typical 6-month-old.
Right.
But there are now coconut waters or even milk if it's an older child, or exactly. So you get a juice box that you can squeeze. So you put the straw in their mouth and then squeeze a little bit so that they don't have to suck. And when they get that response, they'll continue to keep trying different patterns until they figure out how they got that liquid in their mouth. So that's one way. And then the other way is to just take a freestanding straw. So from a restaurant, you just grab a straw and you use your finger to trap a little bit of liquid inside and then put the end of the straw in their mouth and let go so the liquid naturally goes in. And then when the straw is in their mouth, usually most kids will respond reflexively by sealing their lips around it. So they may not actually suck, but they'll hold it. And so if you do that a few times and then slowly start to bring the straw down and then eventually down here, they actually have to suck to draw it up into their mouth. Most kids get that concept, close my lips, the liquid just comes in, hold it here, I have to work a little bit, and hold it here, I really have to suck. And then once they're sucking from here, then you know that they can suck on a cup like this. So those are my strategies.
Okay. Well, I guess I want to round out. Do you have any other tips aside from sort of starting early and, these helpful tips on how to get them to use a straw, but any other tips on weaning in general?
Oh, that's another one that's real specific to, to the situation, to what the child needs in terms of their nutrition and everything else. So most pediatricians will recommend weaning formula by around a year, and then most people also sort of consider a year to be a good place to start weaning breast milk. So people will argue all over the place. There's all kinds of things.
Don't even go there.
Yeah, exactly. But if you're weaning off of, say, a bottle, so whatever's in that bottle, I won't speak to it. But a few things are, again, starting early. So if a child has had a fair amount of time to practice those new motor patterns on the cup that they're going to be using, on a straw cup or on an open cup, whatever it is, it will be easier for them to make that transition than if you're trying to transition and have them learn a new skill all at the same time. So if you've allowed for several months of them to just explore and play and drink a little bit from a different type of cup, that'll lay a good foundation, basically. Once it's time to actually transition, you really are we're done. We need to get off of the bottle and onto the other cup. I'd usually start by putting the most enticing liquid into the cup that you want them to use, the straw cup or the open cup, whatever it is, and then putting the least enticing liquids into the bottle. So for most kids, that's their formula or their milk or even a juice into the straw cup or the open cup, and then it's the water in the bottle. So they don't have they'll want their bottle, but they won't want water as much. And I'd also start at a time that is not going to cause huge explosions. Like usually lunchtime is an okay time to switch out a bottle to a cup for their meal, versus say nighttime, where most kids like to have the bottle to comfort as well as for nutrition.
Right.
So those would be my just small suggestions.
Okay. Well, and then my last question, I guess, would be, you sort of specialize, you're an occupational therapist, pediatric occupational therapist in feeding. So what are some signs, because we did talk about how straws and just eating and drinking in general develop muscles, but what are some signs that parents should look for? Because oftentimes we're just staring at our children, they're the cutest things ever, and sometimes we just, we don't notice maybe some signs that we need to seek help or whatever it is. There might be a slight delay. So I don't know if you could just generalize. What are you looking for, and at what point should you seek help?
So it really depends on the functional impact for the child. So I've seen all kinds of motor patterns that are different from what I would expect, but still functionally work for that child. But if you have a child that often it usually starts even with little babies who refuse anything but the one thing that they're most familiar with. So they like just one type of bottle, and sometimes it's even just the one nipple in that one type of bottle. If they use, maybe mom has 3, but it has to be this special one. Kids who are really, really rigid, it can be a red flag that they may have trouble down the line because they tend to develop one type of motor pattern and they can only go to that motor pattern. They don't branch out as easily. So that might be just a first red flag, and it probably wouldn't be something that I'd say rush out and get therapy for, but it would just be sort of something like, oh, okay, they're really rigid, maybe I should work with them trying to expand that a little bit. And then as they get a little older, that time of transitioning onto solids is another big one. So if they're really resistant to cup drinking, to straw drinking, to whatever it is, if they really struggle with that, or you start giving them purees and they absolutely just really resist and seem very uncomfortable, I strongly suggest seeking out a little bit of help early. It is so much easier to fix a problem at that point than it is to let it get to 6 months down the road when you've got a full-on food battle going on or a big delay going on, to try and then play catch up. So those are my early ones. Obviously speech delays, if you're having a child that's not babbling or that it really is not producing the sounds that you would expect them to produce, those would be red flags that would say, yeah, it might be a good idea to just get an evaluation and talk to your doctor about it.
And, obviously, I'm sure you and I both, we always turn to our pediatrician for most of our questions. But sort of what is the difference between a speech pathologist versus an occupational therapist in feeding, per se?
So feeding is one of those areas that both speech therapists and occupational therapists work on. So you can kind of see either one. If you have a speech therapist who's very well versed in feeding, they can probably do a lot of the same things, or I know that they can do a lot of the same things that I would do. A speech therapist would encompass more of the speech part of it. So if you have a child that has a significant speech delay and feeding issues, you may actually find benefit from seeing a speech therapist. Whereas an OT usually looks more deeply at some of the sensory and behavioral systems, although a speech therapist would do some of that too. And so you're really looking for the professional that has advanced knowledge and training in pediatric oral motor patterns. So either way, you could refer to one or the other. It's just, again, that the speech therapist will look a little bit more at the motor patterns and how they relate to speech, and an OT would look a little bit more about their sensory systems and behavioral systems in addition to the motor patterns of eating.
Okay. And so lastly, I turn to the internet for a lot of things, which is probably not the smartest idea. However, if we do have a parent at home that's just looking for resources, what are some key words that you would be, looking for on the internet if you're searching? I mean, I hear you say oral motor patterns a lot. I don't know if that's like a layman's term or whatnot, but, what are some key words that you could give to our viewers?
I just like feeding difficulties or picky eating, things like that. Like I know that those are the words that people have found me Googling
okay.
words like that. Like,
Okay, that's
like
perfect.
child with who's not eating, or child who's got feeding difficulties, things like that.
Okay.
So, yeah, I'm trying to think of chewing difficulties or, yeah.
Okay. All right, well, that's it, and I hope you guys gained as much knowledge as I did, because I was not expecting so much, but thank you so much for being here. It was
You're
so
welcome.
nice to talk to you.
Absolutely. Nice to meet you.